If you have a brief answer for us, please.
You know, the positive is California successfully moved the IHSS program into getting close to 99% federal, participation rate, up to 99% of the program under Medicaid. And Medicaid has rules, and the Department of Health Care Services is the one that directs the rest of us who run Medicaid programs in Medi-Cal on how the share cost has to work. It's not anything in our domain. It's the Department of Health Care Services that determines the medically needy share of cost level. We're only implementing it, and I appreciate what she's saying, but when it comes to that share of cost issue, it gets tied up into the federal requirements. And when we had the buyout program, the Centers for Medicaid and Medicare, CMS, was threatening us for being out of compliance with the Medicaid rules as it related to share cost. So there was a variety of these reasons that the program got eliminated, but that was probably one of the biggest.
Thank you. We're going to be moving on to the final panel, which is about adult protective services. But, sir, I will allow 1 minute on public comment on this item.
I wasn't planning on speaking. Gary Passmore, Congress of California Seniors, but I wanted to remind Eileen that under state law, by moving all of those long-term services and supports into Medi-Cal, we charge the estate for the full cost of that care when a person is over age 55. This isn't a gift. It isn't free care. It's a loan against a home that may be owned by the family.
Thank you for that context. Thank you. Again, thank you to all of our panelists. Thank you to all of our speakers. We're moving to our final panel, and it is on adult protective services, a budget and program review, and a proposal related to training. Once again, I'm asking for just very brief, just a minute or two, and then we will take questions or comments from the public. Ms. Carroll?
Sure. The California Adult Protective Services Program provides services without regard to income to persons who are victims of abuse, neglect, or exploitation for dependent adults and for the elderly. The counties in, trying to think what the year was, excuse me, I think it was 2 years ago? Yeah, 2011-12, the program was realigned to the counties. And since that time, they have worked towards working with, establishing a support for adult protective service system, responding to investigations, 24-hour emergency response systems, time-limited case management, emergency shelters, in-home protection, multidisciplinary teams. I mean, these are the activities the counties are responsible for. In 15-16, they had an average of 11,093 cases per month, or 133,000 cases on an annual basis. This is a 2.6% increase from last year. The APS funding this year is $195.3 million. 97.8 million of it is federal, 97.4 is the other non-federal sources, the bulk of which is general fund.
Thank you. Is there a representative from the Department of Finance who will be speaking in regard to the comments about the APS program? Anything from Finance thus far?
This is Cheely from the Department of Finance. We have no specific comment on the program and the proposal at this time. And as my colleague mentioned, we are reviewing the materials we get for these proposals as we work towards April and the May revision.
Thank you. We are honored to have someone from the San Francisco County Human Services Agency, one of the APS supervisors, Sarah Stratton, who will talk a little bit about the training proposal. If you could, just real brief, and then we'll see if there are questions, and we'll hear from the public.
Great.
Welcome.
Thank you. Good afternoon, Chairman Thurman and members. My name is Sarah Stratton. I'm a licensed clinical social worker and a supervisor for the APS program for the City and County of San Francisco Human Services Agency. I'm here testifying on behalf of a broad coalition that includes the California Elder Justice Coalition, the California Commission on Aging, and the County Welfare Directors Association to urge your support to provide $5 million to establish a statewide coordinated APS training program. I have been working with APS since the 1990s. When I started with APS, there was very little formal training for new workers. Sadly, nothing has changed in nearly 20 years. There is still very little training offered to new workers or for more experienced workers. The APS program requires a well-trained workforce to meet its state mandates and to protect some of the state's most vulnerable clients. This includes responding 24 hours a day, 7 days a week to reports of abuse and neglect and severe self-neglect. We often find our clients in medical distress with injuries sustained from abusers, living in unsanitary or dangerous conditions, and at risk of eviction and homelessness. The state is still responsible for funding and providing training to APS workers, but it invests only $88,000 in this life-saving program. Yet, APS social workers must understand complex issues that touch all of our cases. This includes having the ability to assess client capacity, determine whether there is undue influence, and understand how medical conditions impact client care. APS workers must be able to respond effectively in a variety of crisis situations. Cases involving financial abuse are highly complex and may involve real property, trusts, brokerage accounts, as well as international scams. It is essential that both new and seasoned APS social workers in all counties have equal access to the most current and advanced training available in these areas. Training will enhance our ability to intervene quickly to stop the abuse and assist our partners in the community, like the police and the district attorney, in identifying and prosecuting elder abuse. Our community depends on us to work with them. They look to APS to hold the expert knowledge in the complex areas of elder-dependent adult abuse and neglect. This proposal would ensure that all new social workers and supervisors have the skill set and knowledge to protect and serve these victims of abuse and neglect. This proposal provides for 96 hours of training for new workers and 56 hours of training for new supervisors. Additionally, it provides for advanced training for determining issues related to determining and assessing capacity and financial abuse issues. Please support this request, and I thank you for your time.
Thank you, Ms. Stratton, for your patience. And, we won't be taking action on this item today, but as a former social worker, always a social worker who was one time a home visitor to homebound seniors, I appreciate what you've outlined, and I can tell you the training received was on-the-job training, and that was about it.
Yes.
And that meant very hardworking social workers told us what to do, what not to do. But I appreciate you lifting up that this is a very valuable program and very needed, very critical, and that we should do it justice by providing some training. Thank you very much.
Thank you.
We want to give the LEO's office an opportunity if there are any comments you wish to provide about the proposal. Thank you. Thank you much. Public comment, we're sticking strictly to 1 minute, strict 1 minute each. Welcome.
Chairman Thurman, I'm Carol Sewell, representing both the California Commission on Aging and our partner, the California Elder Justice Coalition. We thank you for hearing this issue, and we've been very fortunate that we've had sympathetic ears in the budget committees for the last couple of years. Not made progress with this issue, but made some very good headway last year with the codification of the language that created the APS liaison position within the Department of Social Services. We hear that great things are happening there. And we really look forward to the chance to see this training money go in place. We know that this is vital with the growth of the senior population. Poverty and near poverty in that population is growing, and with hardship and economic hardship becomes stress and risk of being more vulnerable to abuse. And we know that that is growing at a very significant rate. So we urge everyone to consider supporting this. Thank you.
Thank you.
Gary Passmore, Congress of California Seniors. This is yet another issue that I'm very supportive of and engaged in. And I wanted to also tell you that something you probably haven't thought about before, we spend a fraction of the amount of money for elder abuse prevention that we do for child abuse prevention. Here in California, it's something like 10% or 20%, and that's going to be a real crisis when we have twice as many old people who are going to be very vulnerable and unprotected. This is a really big issue.
Thank you.
Good afternoon. Lisa Coleman with CalCOA, the California Long-Term Care Ombudsman Association, and in very strong support, just as in the Ombudsman, field workers need good training. It is an investment that pays with quicker and more thorough resolution of complaints. It prevents further problems from growing and becoming more expensive. You've got to train your staff. You've got to train the field people so that they, in turn, do a better job and protect our seniors. Thank you for the support.
Thank you.
Yes, Mr. Chairman, Darrell Kelch with the California Association of Area Agencies on Aging. We are also in support of this. You know, the numbers reported by your staff in terms of the increase in the reporting of elder abuse is almost like 50% in the last 5 years. Part of the reason for that is because those of us at the local level are doing our job, and that's to make the community aware of what elder abuse is and how to report it. But along with that goes the responsibility of being able to do the investigation, and that takes training. The issue of elder abuse is becoming a very significant issue for area agencies on aging. In fact, this year we're going to spend a whole month of June bringing awareness to the community about elder abuse. So we need those that are out there responsible for investigating to be trained properly.
Thank you.
Deborah Doctor from Disability Rights California. My organization is in strong support, and I personally am in strong support. The hardest job I ever did was the first 9 years of my career. I was a social worker. I had 2 days of training. And to say it wasn't enough is a great understatement when I was faced with situations like literally prying a elderly senior out of the sodden and filthy bed in her family's house where she had been neglected. And now I have a mother who's going to be 99 years old in a few weeks, and I'm thankful that my sister lives with her and takes care of her, because when I think of the alternatives for her and the abuse to which she could be subject, that brings me to my personal and our organizational support of this incredibly important issue. Thank you.
Thank you.
Good afternoon, Mr. Chair. Joe Rodriguez. I'm the California State Long-Term Care Ombudsman. As you know, our program investigates reports of abuse and neglect in long-term care facilities. I value the importance of good training for my representatives, and I'm here to support this proposal to improve training for our colleagues in APS. Thank you.
Thank you.
Nicole Wortelman on behalf of the Ventura County Board of Supervisors and San Bernardino County Board of Supervisors in support. Training is really a necessity in this case. Elder abuse is increasing, particularly in the realm of financial abuse, and we strongly support the proposal.
Thank you.
Good afternoon, Audrey Durfer on behalf of Sacramento County. We also support additional funding to the APS Training and Support Program. In Sacramento County, as is the case elsewhere, our APS social workers must have expertise in a variety of different and complex areas, including mental health, physical abuse, financial crimes, and others. So resources to support high-quality training are necessary to protect our vulnerable population.
Thank you.
Thank you, Mr. Chair and members. Kathy Sunderling with the County Welfare Directors Association. Really appreciate the opportunity to have a representative today on the panel and urge your support and consideration of the proposal. As APS nears its 20th anniversary, it really is time for us to create a standardized, formalized training mechanism for the workers who go out, identify, and respond to this abuse. As our population ages, the need will only grow. Now's the time. We appreciate your support.
Thank you.
Connie Arnold in support of the proposal. I think it's very important to protect seniors and those that are dependent adults from abuse. At the same time, I think on the other hand, you also have to look at that you need to provide a greater pay rate for IHSS providers so that we are able to recruit workers who are able to work for us. And also that, you know, if I was nonverbal, it's very interesting. The water's hot in the shower. I have to tell them, turn down the hot water.
I'd like to ask you to conclude,
so, thank you.
Unless you're going to continue speaking on the APS proposal. Thank you.
Rebecca Gonzalez with the National Association of Social Workers California chapter, also in support of this worthy proposal. The silver tsunami is coming. It seems like we always think about our seniors last, and this funding has been inadequate for a number of years, and we really support this proposal. Thank you.
Thank you. I know somewhere Assemblymember Brown is smiling because of the mention of the silver tsunami as she talks about the aging of Californians, and she's right. I want to thank all of our panelists who provided testimony today, to all of our staff for all of your work and preparation and support, to thank everyone in the public who has spoken, and to everyone who has helped to make this very robust conversation today about APS, about IHSS, about SSI and SSP, basically about what we do to help those who are the least among us, those who are living in poverty, those who deal with illness or disability, our seniors, and we owe them our continued conversation and attention to these matters, and we owe them our swift and decisive action to restore just really decimating cuts that have been made to our social safety network over many, many years. I'm looking forward to that work with us together, and with that, our hearing is adjourned. Thank you.